Session 3 Nutrition. In Rwanda, nutrition of children has been tackled through a multi-sector approach since 2013. In 2014, the government of Rwanda adopted a national food and nutrition policy that has been implemented by different sectors. The social cluster ministries, through the Early Child Program Coordination, coordinates the implementation of nutrition activities from national to decentralized levels. Considerable progress has been made in reducing malnutrition in children and women of reproductive age. Under this policy, nutritional interventions will be integrated in the essential RM and CAH interventions by level of care to address the life cycle of malnutrition. Challenges are children who suffer from malnutrition can experience its effect for life. In short term, malnutrition results in higher rates of mortality and decreased cognitive, motor, and language development. Long-term consequences include an increase in non-communicable diseases, low school performance, and decreased work capacity. Ultimately, this affects society as a whole, limiting the ability of young generations to advance out of poverty and contribute to Rwanda's development. Child mortality associated with malnutrition has already reduced Rwanda's workforce by 9% by UNICEF 2020 report. District plans to eliminate malnutrition. Each district developed a district plan to eliminate malnutrition. These DPEMs were to give priority for stunting prevention while continuing to promote active identification of acute cases of malnutrition, improve micronutrient nutrition, and promote maternal, infant, and young child nutrition, as well as other policy priorities. At the local level, multi-sector nutrition committees are composed of mayors, district directors of health, nutritionists, agronomists, and social protection, veterinary and hygiene and sanitation officers. The JAF coordinates activities at district and sector levels. The solutions to limit malnutrition include: there is still a lot of to be done to ensure that all children have equal opportunities to grow up well nourished so they can thrive and reach their full development potential. To address malnutrition in children as well as in pregnant and lactating women, districts will strengthen government systems to better plan, budget for, implement, and monitor nutrition interventions. Roles and responsibilities of local government. 1. Mobilize pregnant women to do antenatal care and plan to deliver at health facility. Make sure that all children are fully immunized according to a national vaccination calendar. Support the work of community health workers by a regular monitoring of their interventions. Conduct community education on pregnancy prevention and benefits of family planning use. Support reproductive health clubs for youth. Put in place strategies to mainstream gender responsive at work and in households. Key points to remember from this topic include: a child's first 1,000 days build a foundation for a child's development. Vaccines reduce risks for getting a disease by working with your body's natural defense to build protection. Immunization is key component for primary health care and an indisputable human right. In Rwanda, the vaccination calendar for newborns, infants, and young children is at day 1, week 6, week 10, week 14, month 9, and month 15. Annual maternal and child health weeks are organized twice a year. Community health workers are a formal part of the national health strategy and are coordinated by the community health desk of the Ministry of Health. Abstinence is the safest way to avoid unintended unplanned pregnancies. The use of contraception reduces the maternal and child mortality and improves the family well-being. Contraceptives and other family planning methods are available in the following institutions: in health centers and all public hospitals, or sponsored by the government, in private clinics and pharmacies, in centers providing productive health services to the youth. The big challenge to the adolescents is to adapt the positive behavior according to their physical and psychological changes. Protecting women and girls from gender-based violence is protecting the whole family, community, and even the society in general. Districts will also support positive behavior change interventions with activities including community growth mentoring and promotion sessions, nutritious food and cooking demonstrations, nutrition education, counseling on complementary feeding practices, and improving family and individual nutrition habits, sustaining a multi-sector campaign to promote the concept of the first 1,000 days, the importance of related services and key practices, assurance of partners' support for DPEM implementation focusing on stunting, developing an effective linkage between national First 1,000 Days campaign and community-based nutrition programs in the district. We have come to the end of topic 1. See you in topic 2, epidemic and